Hello, ladies and gentlemen of the board, and welcome to the third quarter Board of Directors meeting. In today's meeting, I'd like to review EvoCol's current state regarding funding, intellectual property, and the challenges we're currently facing. And then I'll brief you on our proposed pivot to address these challenges, including our 3 licensing options and our recommendation to the board. As you know, thus far we've raised $200,000 for a 20% equity stake with a 1x exit preference. We also have $100,000 in debt with 20% stock warrants as collateral. This leaves 80% for the founders and 20% for you, the investors, assuming no default. As far as IP, we have 3 patents issued by the USPTO for our colon tissue cell culture techniques, our composite 3D printing technology, and our medical imaging processing software. As you know, our medical imaging and 3D printing technology are cutting edge and have many potential applications outside of colon tissue production. This gives us a distinct advantage in the 3D printing space. However, we also face a few challenges. Long production timelines for our products preclude the use of colon implants for emergency surgeries, which are pretty frequent for the diseases that we're targeting. And even for non-emergent surgeries, a delay might cause a condition to worsen or prolong discomfort for the patient. We've also found that very few patients are willing to opt into a second surgery to receive the implant once it's ready. Outside of the tissue engineering space, we have very limited experience with other materials such as resins or filaments, which hinders our ability to expand into the 3D printing industry without additional costs to hire or consult with experts. To address these challenges, we propose a pivot from manufacturing tissue products to software for mass customization of medical products. Our existing technology allows processing of medical imaging such as MRI and CT scans and design of custom products tailored to the patient anatomy. We're simply extending this technology to other medical applications. Our technology is some of the most advanced in the field. This new approach allows us to focus on this strength. We use a license-based approach to eliminate further product development costs and to provide us the opportunity to partner with leaders in the biotech field to bring our technology to a variety of medical applications. Lastly, this approach allows us to maintain our focus on improving quality of life for patients. We're simply expanding from colectomy patients to a much wider scope, but maintaining the same values and vision. Under this plan, we have 3 main options for licensing. Our first option is to license to Carbon, an innovative 3D printing company, which uses clip technology to rapidly produce high-quality parts. Carbon has offered us a $500,000 one-time fee for an exclusive license. They'll use our technology to improve their precision dental surgical guides and their custom dentures and to expand into other medical applications. After repaying our debt and your 1x exit preference, this licensing agreement leaves us with $160,000 for the founders and a total of $240,000 for the investors, which is a 1.2x return. Our next option is to license to biotech leader Johnson & Johnson. This license would be 10% royalties, no upfront fees for an exclusive 5-year license with the option to renegotiate at the end of the term. Johnson & Johnson would use our technology for customizing surgical tools, medical implants such as titanium bone replacements, and tissue printing for joint replacements. The 3D printing for medical applications industry is forecasted to grow to $1.8 billion by 2022. And if Johnson & Johnson captures just 0.5% market share using our technology, that'll be $9.4 million in sales, which will give us royalties of $940,000. After paying back debt and exit preference, this leaves us with $512,000 for the founders and $328,000 for the investors, which is a 1.6 return on investment. Our last option is a non-exclusive license. This would be no upfront licensing fees, 5 to 7% royalty on sales, and 3 to 5 year terms with options to renegotiate. Here you can see some of our prospective licensees and the potential royalty revenues from each. We have 3D Systems, whose focus is on anatomical models for training. They have a market cap of $2 billion. Materialize, who produces anatomical models customizes implants and surgical guides, and has a market cap of $603 million. Johnson & Johnson and Carbon we've already discussed. And lastly, Dassault Systems, with biomedical material modeling applications and a market cap of $35 billion. Negotiating this licensing agreement with Johnson & Johnson, or this licensing agreement with only 2 of these companies would exceed the revenues from the agreement with Johnson & Johnson. And it gives us potential revenues up to $2.6 million, which leaves $1.87 million for the founders and $726,000 for the investors, a 3.6x return. Thus, we recommend the non-exclusive license, not only for the potential for greater return on investment, but because a non-exclusive license encourages growth and innovation throughout the sector, and an increase in innovation in the 3D printing for medical applications sector aligns with our mission, improving quality of life for patients. That concludes my brief. What are your questions?